Trimethobenzamide, also known as Tigan, is a medication used to treat nausea and vomiting that may occur after surgery or with a certain stomach/intestinal problem, gastroenteritis. It is important to treat vomiting quickly to prevent dehydration. It is not recommended for use in children due to the risk of serious side effects. The typical adult dosage is 250 mg every 6 hours, but your doctor may adjust the dosage based on your condition. It is best to take Tigan with food to reduce the risk of stomach upset. Always follow your doctor's instructions for the best results. Here's how to take Tigan. Take this medication by mouth as directed by your doctor, usually 3 to 4 times a day. The dosage is based on your medical condition, age, and response to treatment. It's important not to increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. If your condition lasts or gets worse, make sure to tell your doctor. Some common side effects of taking Tigan may include diarrhea, headache, dizziness, drowsiness, or blurred vision. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist as soon as possible. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits of taking it outweigh the potential risks of side effects. Many people who use Tigan do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as changes in mood or mental state, yellowing of the eyes or skin, muscle spasms, or unusual uncontrolled movements. Seek medical help right away if you experience seizures or notice symptoms of a serious allergic reaction, like rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of potential side effects, so if you notice any other effects not mentioned here, be sure to reach out to your doctor or pharmacist for further guidance. And as always, if you have concerns about the side effects of Tigan, don't hesitate to discuss them with your healthcare provider. Before taking Tigan, it's important to inform your doctor or pharmacist about any allergies you may have or if you have a history of liver disease, kidney problems, stomach or intestinal issues, brain swelling or disease, dehydration, or electrolyte imbalances. This medication may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how Tigan affects you. If you're using marijuana, be sure to talk to your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using. It's also important to note that older adults may be more sensitive to the side effects of Tigan, particularly unusual uncontrolled movements and shaking. If you are pregnant, only use this medication if clearly needed and discuss the risks and benefits with your doctor. It's unknown if Tigan passes into breast milk, so consult your doctor before breastfeeding. As always, it's important to follow your doctor's instructions and take Tigan as prescribed. It's important to be aware of potential interactions with other medications you may be taking. This includes prescription, non-prescription, and herbal products. Always keep a list of all the products you use and share it with your doctor and pharmacist. If you are taking medications that cause drowsiness, such as opioid pain relievers, alcohol, or drugs for sleep or anxiety, it's important to let your doctor or pharmacist know. This also applies to muscle relaxants and antihistamines. Additionally, it's a good idea to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns about using these products safely, don't hesitate to ask your pharmacist for advice. If someone has taken too much Tigan and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or the local poison control center. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. This medication should only be used for the condition for which it was prescribed. Do not share this medication with others. If you forget to take a dose of Tigan, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take extra doses to make up for the missed one. When it comes to storing Tigan, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a safe place that's out of reach of children and pets. And when it comes time to get rid of any unused Tigan, be sure to consult your pharmacist or local waste disposal company for proper disposal instructions. Never flush it down the toilet or pour it into a drain unless specifically instructed to do so. And always discard the product and it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.